Assalamu alaikum, everyone. Thank you so much for inviting me, first of all, to this conference. My sincere appreciation goes to Dr. Javed Akram, Dr. Somia, Dr. Wafa. It's been a pleasure to hear and learn from all of my esteemed colleagues. My topic is a very different topic. It goes essentially to the heart of what it means to be a physician. So I'm speaking about medical aid in dying, the Canadian experience. This is a gentleman named Alan Nichols. This is the day before he died in a BC hospital room, and behind him is his brother Gary. So we're going to learn about what happened to Alan. In June 2019, a neighbor called the police in Chilliwack, BC, to check on Alan Nichols. Alan was 63 years old. He had a benign brain tumor at the age of 12, which left him with a weak right side and hearing loss. He also had chronic depression. After the death of his parents, he lived alone. His brother Gary had moved to Edmonton, but another brother, Wayne, was nearby. Wayne did his grocery shopping, took him banking. Alan worked as a gardener and a janitor before obtaining disability benefits. His family cared for him for all of his life. Alan would have periodic decompensations when he would stop eating and drinking. He would be admitted to the hospital, get better again, and live his life. This time he was found dehydrated on the floor of his condominium. He was admitted involuntarily under the Mental Health Act to the psychiatric ward. His brother Gary flew out to see him. After 5 days on the psychiatric ward, he was well enough to be transferred to the general medicine ward. On July 22nd, a doctor called Gary to tell him that Alan was scheduled to die in 4 days by medical assistance in dying. Gary began to cry. He begged for answers, but because of patient confidentiality, he was told that this was Alan's decision. There is no obligation to inform or interview family members. We have to remember that Alan was not terminal, and he had recently been admitted for an acute on chronic depression. So on July 26th, in Alan's hospital room, Alan was put to death by a lethal cocktail of drugs as Gary watched. This is the typical protocol for MAID. It's usually a cocktail of 3 medications. So he would have received 10 milligrams of midazolam ID. After that, he would have received 1,000 milligrams of propofol to induce coma, followed by a paralytic. And typically in Canada, they use rocuronium. Sometimes lidocaine is added to prevent burning from propofol. And on very rare occasions, bupivacaine will be given to induce cardiac arrest. Alan was dead in 15 minutes. Since then, Alan's family has been searching for answers from various authorities, including the Coroner's Office of BC, the police, members of Parliament, the College of Physicians and Surgeons of BC. They cared for him for 50 years, were left grieving, and still have no answers. So just a brief overview of my talk. I'm going to be talking about the Benelux group of nations, Belgium, Netherlands, and Luxembourg. I'll then go on to look at the Canadian experience, and we'll particularly look at the changing social values which have allowed MAID to take root in Canada. We'll be looking at secularism and personal autonomy as a key driver behind euthanasia. MAID, or euthanasia, was legalized in Holland in 2002. It was initially for terminally ill patients who are typically elderly and suffering greatly without prospect of cure. Prior to 2002, euthanasia was practiced on compassionate grounds without prosecution for physicians. Holland, Belgium, and Luxembourg were strongly Catholic nations, but by the mid-1950s, these societies had moved away from religion and the Catholic Church to embrace what they call secular humanism. In Holland, euthanasia was expanded to include chronic medical conditions. It was then expanded to include psychiatric euthanasia. Most of the patients who had psychiatric euthanasia suffered from major depression, but some had personality disorders and some were autistic. Dr. Boudewijn Chabot is a Dutch pioneer in euthanasia and a psychiatrist. And he himself is feeling alarmed. He feels that euthanasia, as it currently exists in Holland, is fueling the death wish of vulnerable people trying to live with their disabilities. In 2020, euthanasia was expanded to include terminally ill children, and now the Dutch are contemplating what they call a completed life track for those who believe their lives are completed. Each MAID death must be reviewed by a 3-member review board, which consists of a doctor, a lawyer, and a bioethicist. So other jurisdictions in which euthanasia is legal, there are some states in the US where it's legal, Colombia in South America, the Australian state of Victoria, New Zealand, it's coming to New Zealand, it's legalized in Spain, and Britain and the UK is mulling this over. So what happened in Canada? In 1993, Sue Rodriguez, who had amyotrophic lateral sclerosis, petitioned the Supreme Court in Canada to allow her to get an assisted death. The Supreme Court at that time upheld the law which criminalizes physician assistance in dying. In 1994, Rodriguez died after assistance by an anonymous doctor in the presence of an MP. By 2015, the Supreme Court of Canada had changed their mind, and they unanimously decided to decriminalize medical assistance in dying. In 2016, Canada passed Bill C-14, which was the first legislation governing MAID in Canada, and these were the eligibility criteria. A person had to be aged 18, they had to be facing a grievous, irremediable condition with unbearable suffering, and facing a reasonably foreseeable natural death, which means that they had to be terminal. 2 independent witnesses had to witness their consent. There was a 10-day reflection period allowing them to change their mind. A patient had to be assessed and approved by 2 doctors. In 2019, something else happened. Bill C-14 was ruled unconstitutional and discriminatory for those with chronic medical conditions. And then what happened is that Parliament introduced a new law, Bill C-7, which allowed for death for people who weren't dying. Again, these were people who suffered from chronic, unbearable conditions without reasonably foreseeable natural death. Instead of 2 witnesses, now there was only one witness required, and that person was allowed to be a caregiver or a medical professional, which brought up alarm bells in the minds of certain stakeholders. The 10-day reflection period was eliminated. For these Track 2 patients, as they're called, they were given a 90-day minimum, during which time they could seek consultation and treatment, but there was no necessity for trying any treatments before being approved for MAID. We have to also remember that this bill was passed in 2021 during the height of the coronavirus pandemic. According to Health Canada's 3rd annual report on medical aid in dying, as of 2021, over 31,000 people died of MAID. The rate, MAID currently comprises about 3.3% of all deaths across Canada, but there is regional variability. Vancouver Island has the highest rate of MAID in the world. And we can see that the Netherlands, even since 2002, remain at about 4%. Those who seek MAID typically have cancer. The rest of them have chronic cardiovascular conditions and neurological conditions such as ALS and MS. There is a roughly equal ratio of men to women who seek MAID, and what's really important to understand is that this demographic, they're mostly white, they're mostly affluent, and they're used to being in control of their lives. But with Track 2 MAID and psychiatric MAID, these demographics are changing. 68% of those who provide MAID are family doctors. Now let's talk about the health savings for a minute. The Parliamentary Budget Office estimated the 2021 savings to be $89 million for that year alone. MAID is cheap, it's nationally available, it takes only days to weeks to obtain. While Canadian healthcare, I can tell you, is publicly funded and currently it's in a state of collapse. It is impossible to get consultations, especially for psychiatrists, for needed surgeries, and this means that we are offering MAID in the context of medical care that is not available. Philip Nitschke is a doctor from Australia. He originally trained as a physicist, then became a doctor. He's known as Dr. Death. He eventually lost his license in Australia and currently lives in the Netherlands. He is an inventor, and he invented something recently called the suicide pod, or the sarcopod, which is actually short for sarcophagus. So what this is he sells people the pod. It's, you can download it by a 3D printer. One enters the pod, presses a button, and then nitrogen flows into the pod, releasing the proportion of oxygen, and the patient dies of asphyxia. So this is currently legal in Switzerland, and he's petitioning for it to be legalized in the Netherlands. Where we are in Canada right now is that MAID has now been approved for mental illness as sole criteria. It would have been legal as of March 17th of this year, so in a few days, but there's been an outcry by psychiatrists and others which have led the government to delay the implementation by 1 year. As of now, expert committees are studying ways to implement expansion of euthanasia to mature minors, meaning children, as well as advanced directives for those who have dementia. I want to emphasize once again that Bill C-7 was enacted during an unprecedented pandemic when the strains on healthcare were unbearable. Another ramification of MAID involves organ donation. So initially, the transplant community considered it unethical to retrieve organs from people who died by MAID, but now MAID is considered a pipeline for recipients on very, very lengthy waiting lists. Initially, many doctors were reticent to voice concerns over C-14 because of professional backlash. There are very strong notions of personal autonomy in Canada, although MAID is not an autonomous act. It is state-sponsored with doctors, not patients, administering death. Because in Canada, Medicare is publicly funded, it means that state is taxpayer funded. For Track 2 patients with chronic conditions, those conditions are self-determined and suffering is subjective based on the patient's definition. In Canada, we cannot insist that the patient try different remedies because it's felt that this impedes the patient's autonomy. This is in contrast to the situation in the Netherlands, where all treatments must be attempted for a reasonable amount of time before MAID or euthanasia is approved. Doctor shopping is now occurring in Canada, which means that any number of consultations can be sought. These consultations are paid by the taxpayer until 2 doctors can be found who will approve of the application. Euthanasia skirts the responsibility of society and of government to provide medical care, especially at the end of life or for chronic intractable conditions, resulting in potentially huge healthcare savings, both federally and provincially. There is essentially no access to psychiatric care. Cancer care takes a long time. Surgeries, especially joint replacements, take over a year in Canada. When we expand MAID in Canada, it further de-incentivizes investment in needed healthcare and disability and social supports. In Canada, there is no mandatory review of cases, therefore there is no oversight. MAID providers police themselves. Negative stories about MAID that are now coming out in the media are actually called clickbait by MAID providers, even as they privately acknowledge the abuses of MAID. More doctors, however, are becoming vocal. Fewer doctors are interested in performing Track 2 MAID, and we have to remember that Alan Nichols, his MAID was approved based on hearing loss, even though he had cochlear implants. Psychiatric MAID has galvanized many Canadians, and we know that suicidality is one of the key features of many mental disorders. Furthermore, it's impossible to define irremediability in mental illness. We just don't know who will get better and who will not get better. Dr. Madeline Lee is a psychiatrist and a MAID provider, and she's been worried about safeguards even before the advent to expand to the mentally ill. What she says is that each doctor brings their own biases to every case, and so there's inconsistency on how the law is applied. The other concerning aspect is that doctors have been told that they cannot question the appropriateness of MAID in any particular case. Even if the patient legally meets the legal eligibility criteria, what it means is that clinical assessment and clinical judgment is being eroded. She also calls for national oversight. She cites the insufficient mental health care available and also the doctor shopping. She is talking about the Benelux experience where the rates of euthanasia are going up, even though psychiatric health care is much better there than it is in Canada. And again, she talks about the changing demographics for Track 2 people and those who seek psychiatric MAID. These are people who are young, 70% are women, they're poor and they're vulnerable. It's a completely different demographic. Trudeau Lemons is a University of Toronto professor of law, and he talks about how the government has prioritized ending of life on the basis of an abstract notion of autonomy without recognizing the social context. We talk about MAID being voluntary, but if you know that you're going to be put in a nursing home and warehoused in substandard conditions, as happened during the pandemic, or if you're a person with disability without access to adequate care, all of these conditions will influence your decision to apply and get MAID. On a practical level, it's virtually impossible in Canada to get, in Track 2 cases, to get needed consultation and treatment within the 90 days stipulated by law. Many doctors in palliative care are leaving palliative care because of the pressure to consider MAID early, even before palliative care can be obtained. Conscience rights of doctors are not upheld by law, and now we're talking about expansion to mature minors, people who cannot drive till they're age 16, they cannot vote till age 18, they cannot marry till age 18, yet they're being offered the chance to ask for death. I just want to talk a little bit more about the demographics of Track 2 and psychiatric MAID. 70% are women, they're poor and they're marginalized, they're without family or friends. Based on Benelux data, Track 1 patients are people who are white, affluent, and educated. They're used to having a good life, they want a good death, they want control. The other demographic, those are the people who need suicide prevention. Now, I guess we really should be considering what is driving the wish for euthanasia. It's not physical suffering, not according to studies. Physical suffering, we know, can be alleviated by good palliative care. Really what's driving this is existential suffering, loneliness, lack of meaning, and social isolation, as well as the need for self-sufficiency, the idea of personal autonomy. Society and the media narrative so far has been that these are good, beautiful deaths based on individual control of the dying process at a time and a place of one's choosing. There was another story. Arthur Cole was an 80-year-old who had metastatic thyroid cancer. He was sent home with a tracheostomy, which his wife had to manage without any home care. He asked for home palliative care, was told it was not available, but a doctor offered to come and do MAID at home. And he died by MAID at home within 2 weeks. CAMAP is the Canadian Association of Medical Assessors and Providers. They just received 3.3 million Canadian dollars from the federal government to implement MAID and talk about expansion. Now, what they're encouraging doctors to do is to suggest MAID early, rather than waiting for the patient to initiate a discussion, further raising alarms about coercion. If we take a step back for a little minute, we can see that from 2016 to 2023, Canada has become the most permissive MAID jurisdiction in the world. We went from terminal patients to Track 2 patients, to patients with mental illness as sole criteria, to mature minors, to advanced directives, and now we're talking about organ donation, either post-MAID or even via MAID. I want to share with you just something from Holland. There was a patient who was about 74 years old. She had mild dementia and had talked about maybe wanting to have euthanasia at some point. When she was 74, her family members decided that now was the time. The doctor gave her a sedative in her coffee. While the doctor was giving the injection, the patient woke up. Family members had to hold this lady down while she was fighting the injection so the doctor could essentially kill her. She was charged with homicide, but she was acquitted of homicide. Just a little bit about the finances there. MAID is a huge savings for healthcare dollars in Canada. In 2021, our global budget deficit was $90.2 billion. Just a little bit about organ donation post-MAID. Canada is the world leader. And there was a New England Journal of Medicine paper that actually talked about euthanasia via organ donation. We know that organ donation is most successful when the organs are most viable, so they suggested, why not, if the patient is dying anyway, take them into the OR, give them anesthetics, harvest the organs, and allow that to be the nature of their death. This brings up profound questions about the dead donor rule. Another development in the US, this is not yet legal in Canada, is normothermic regional perfusion, whereby a patient is declared dead by circulatory criteria. They then restore blood flow so that the organs remain viable while restricting blood flow to the brain. So the blood flow is, perfusion is directed towards the abdomen and sometimes to the chest if lungs or hearts are wanting to be retrieved. And the question then is, was the patient actually dead when you retrieved the organs? So these are all very, very, very troubling ethical conundrums. The other question to ask ourselves is, will the option to die at some point become the duty to die? Is MAID the new eugenics? And we know that this has happened in Nazi Germany. I believe that MAID, euthanasia, is a game changer for the medical profession. We have to look at our changing social values in Canada and the West. Bioethics has replaced religious values and morals based on religion. We are a society where utilitarianism rules. Those who don't produce and contribute to the GDP are considered useless eaters, in the Nazi phrase. We believe in personal autonomy above all, the belief that the individual self-interest is the only consideration and that the state owes the individual this personal autonomy, which includes more and more rights, including the right to die when and where we desire, all paid for and provided by the state. My questions to you are, where do we go from here? As a society, as a profession? I would love to hear the Pakistani perspective on euthanasia, and I welcome your questions. Thank you for listening. These are links to two of my publications in a national newspaper and a national magazine. And this is just a painting of the ideal death, where the person dies at home in their own bed, surrounded by family and by clergy. Thank you so much for listening.
Thank you very much, Madam, for talk on such a sensitive topic and giving us what in the perspective of what is being going on around the world relating to euthanasia. We will take the question and answer sessions shortly after a while, because we are honored to have with us Professor Dr. Mukhtar Ahmed, who is the chairman of Higher Education Commission of Pakistan. Just briefly to add on, Dr. Ahmed was responsible for linking all national and international stakeholders for the implementation of reforms initiated by Government of Pakistan in higher education sector.